Welcome to the Learning Media International Public Health Issues, this time in the theme of antibiotic resistance with me, Susilowati. After watching this video, students are expected to understand what is antibiotics and bacteria, or what is antibiotic resistance, and what are key factors antibiotic resistance. And students are expected to understand scope of the problem of antibiotic resistance and how to prevent and control for scope on individuals, policymakers, health professionals, healthcare industry, and agriculture sectors. After that, students are expected to understand recent development for antibiotic resistance and impact for antibiotic resistance and what are WHO response for antibiotic resistance? There are 5 strategic objectives and multiple initiatives to address antimicrobial resistance, like World Antibiotic Awareness Week, the Global Antimicrobial Resistance Surveillance System or GLASS, Global Antibiotic Research and Development Partnership or GARDP, and Interagency Coordination Group on Antimicrobial Resistance or IACG. What is antibiotics? Antibiotics are medicines used to prevent and treat bacterial infections. Antibiotics, also known as antibacterials, are medications that destroy or slow down the growth of bacteria. They include a range of powerful drugs and are used to treat diseases caused by bacteria. Antibiotic resistance occurs when bacteria change in response to the use of these medicines. And what is bacteria? Bacteria, not humans or animals, become antibiotic resistant. These bacteria may infect humans and animals, and the infection they cause are harder to treat than those caused by non-resistant bacteria. Antibiotic resistance leads to higher medical costs, prolonged hospital stays, and increased mortality. The world urgently needs to change the way it prescribes and uses antibiotics. Even if new medicines are developed without behavior change, antibiotic resistance will remain a major threat. Behavior changes must also include actions to reduce the spread of infection through vaccination, hand washing, practicing safer sex, and good food hygiene. This is key facts about antibiotic resistance. Antibiotic resistance is one of the biggest threats to global health, food security, and development today. Antibiotic resistance can affect anyone of any age in any country. Antibiotic resistance occurs naturally, but misuse of antibiotics in humans and animals is accelerating the process. A growing number of infections such as pneumonia, tuberculosis, gonorrhea, and salmonellosis are becoming harder to treat as the antibiotics used to treat them become less effective. Antibiotic resistance leads to longer hospital stays, higher medical costs, and increased mortality. Scope of the problem antibiotic resistance. Antibiotic resistance is rising to dangerously high levels in all parts of the world. New resistance mechanisms are emerging and spreading globally, threatening our ability to treat common infectious diseases. A growing list of infections such as pneumonia, tuberculosis, blood poisoning, gonorrhea, and foodborne diseases are becoming harder and sometimes impossible to treat as antibiotics becomes less effective. Where antibiotics can be bought for human or animal use without a prescription, the emergence and spread of resistance is made worse. Similarly, in countries without standard treatment guidelines, antibiotics are often overprescribed by health workers and veterinarians and overused by the public. Without urgent action, we are heading for a post-antibiotic era, in which common infections and minor injuries can once again kill. Prevention and control. Antibiotic resistance is accelerated by the misuse and overuse of antibiotics, as well as poor infection prevention and control. Steps can be taken at all levels of society to reduce the impact and limit the spread of resistance. This is prevention and control for antibiotic resistance. To prevent and control the spread of antibiotic-resistant, individuals can only use antibiotic when prescribed by a certified health professional. Never demand antibiotics if your health worker says you don't need them. Always follow your health worker's advice when using antibiotics. Never share or use leftover antibiotics. Prevent infections by regularly washing hands, preparing food hygienically, avoiding close contact with sick people, practicing safer sex, and keeping vaccination up to date. Prepare food hygienically following the WHO 5 keys to safer food, like keep clean, separate raw and cook truly, keep food at safe temperatures, use safe water and raw materials, and choose foods that have been produced without the use antibiotic for growth promotion or disease prevention in healthy animals. To prevent and control the spread of antibiotic resistance, policymakers can ensure a robust national action plan to tackle antibiotic resistance is in place, improve surveillance of antibiotic-resistant infection, strengthen policies, programs, and implementation of infection prevention and control measures, regulate and promote the appropriate use and disposal of quality medicines, make information available on the impact of antibiotic resistance. And this is prevention and control for health professionals level. Health professionals can prevent infection by ensuring your hands, instruments, and environment are clean. Only prescribe and dispense antibiotics when they are needed according to current guidelines. Report antibiotic-resistant infection to surveillance team. Talk to your patients about how to take antibiotics correctly, antibiotic resistance, and the danger of misuse. Talk to your patients about preventing infections, for example, vaccination, hand washing, safer sex, and covering nose and mouth when sneezing. The prevention and control in health industry level. To prevent and control the spread of antibiotic resistance, the health industry can invest in research and development of new antibiotic, vaccines, diagnostics, and other tools. To prevent and control the spread of antibiotic resistance, the agriculture sector can only give antibiotic to animals under veterinary supervision, that use antibiotic for growth promotion or to prevent diseases in healthy animals, vaccinate animals to reduce the need for antibiotics, and use alternatives to antibiotics when available. promote and apply good practices at all steps of production and processing of foods from animal and plant sources, improve biosecurity on farms, and prevent infection through improved hygiene and animal welfare. What recent development for antibiotics resistance? While there are some new antibiotics in development, none of them are expected to be effective against the most dangerous forms of antibiotic-resistant bacteria. Given the ease and frequency with which people now travel, antibiotic resistance is a global problem requiring efforts from all nations and many sectors. What the impact of antibiotic resistance? When infections can no longer be treated by first-line antibiotics, more expensive medicines must be used. Longer duration of illness and treatment, often in hospitals, increases healthcare costs as well as economic burden on families and societies. Antibiotic resistance is putting the achievements of modern medicine at risk. Organ transplantations, chemotherapy, and surgeries such as caesarean sections become much more dangerous without effective antibiotics for the prevention and treatment of infections. And what WHO response for antibiotic resistance? Tackling antibiotic resistance is a high priority for WHO. A global action plan on antimicrobial resistance, including antibiotic resistance, was endorsed at the World Health Assembly in May 2015. The Global Action Plan aims to ensure prevention and treatment of infectious diseases with safe and effective medicines. What are WHO response for antibiotic resistance? WHO respond with five strategic objectives through Global Action Plan on Antimicrobial Resistance. There are to improve awareness and understanding of antimicrobial resistance, to strengthen surveillance and research, to reduce the incidence of infection, to optimize the use of antimicrobial medicines, to ensure sustainable investment in countering antimicrobial resistance. WHO also responds with multiple initiatives to address antimicrobial resistance, like a World Antibiotic Awareness Week. This is held every November since 2015 with the theme Antibiotics Handled with Care. The global multi-year campaign has increasing volume of activities during the week of the campaign. And the second is the Global Antimicrobial Resistance Surveillance System or GLASS. The WHO supported system support a standardized approach to the collection, analysis, and sharing of the data related to antimicrobial resistance at the global level to inform decision-making, drive local, national, and regional action. The other multiple initiatives to address antimicrobial resistance for WHO response for antibiotic resistance through Global Antibiotic Research and Development Partnership or GARDP. This is a joint initiative of WHO and Drug for Neglected Diseases Initiative. GARDP encourage research and development through public-private partnership. And the last is Interagency Coordination Group on Antimicrobial Resistance or IACG. The United Nations Secretary General has established IACG to improve coordination between international organizations and to ensure effective global action against this threat to health security. Thank you for watching and attention on this media. If there is still something not understood, you can ask and discuss with me on predetermined platform.